Good day. I'm Corby Skinner, and I'm the host of Living Well in Montana. And this is a program of LIFT. And let me tell you what LIFT stands for. It's Living Independently for Today and Tomorrow. And it's a program that serves 18 counties in southeastern Montana. And it has all kinds of services. And part of the reason we have this TV program is to help people know how they can access some of the services for LIFT. So today we have, I think maybe for the first time on our TV program, our executive director, Carlos Ramalho. And we have a guest today, Melissa Marshall. And I am going to turn this over to Carlos to introduce Melissa. Carlos?
Good morning, everybody. It's a pleasure to be here. It's true, it's the first time that I am on the show. And I am so happy that Melissa Marshall accepted our invitation to be a guest on the show. I met Melissa in a project that LIFT is working with the Partnership for Disaster. And Melissa is the Director of Operations. Melissa, why don't you introduce yourself to our audience? Tell us who you are, what is your experience with disability issues, disability rights, and what is your job at the partnership? Please.
Thank you. And thank you for inviting me to be here, Carlos. It's an honor. And hello, everyone in Montana. And it's been my pleasure to work with people in Montana through Project Alive. And it's been great. So thank you so much for having me. I am the Director of Operations for the Partnership for Inclusive Disaster Strategies. And that means I coordinate operations. I'm the lead trainer. I work on administrative issues. I help with our hotline. I help with all different kinds of things that we do. I help write grants. I do a various number of things. We're a small team, so kind of everyone does lots of different things. I have cerebral palsy that obviously I was born with, and I use a scooter now, though for much of my life I walked, not great, but I walked most of the time. And I started getting involved in disability rights when I couldn't go to high school because the high school is inaccessible to me. And they sent me to school in the next town over, and I had to spend a lot of time explaining why I lived in one town and went to school in another when it didn't look, in air quotes, like there was anything wrong with me. And started doing my first disability awareness trainings and bias trainings then when I was 17. Went to college and created a major in what's now called disability studies. And I got to be, as far as we know, the first person in the country to do that. And moved to Connecticut, where I still live. That was many decades ago. And I went to the University of Connecticut School of Law. And I went to law school to be the best disability rights advocate I could be. I didn't go to practice law per se. And I think I've officially practiced law for a grand total of 6 hours. I'm admitted at the bar and I can, but I like doing regular advocacy better. I like doing other kinds of advocacy better. That's just what calls me more. So I've been involved in disability rights. I'm going to date myself. And now that I have silver or COVID gray hair, you can see I'm older. And I've been doing this for a very long time. I've specialized in training and technical assistance for all areas of the Americans with Disabilities Act. So I do everything from going to buildings to do surveys, to give policy information, to help develop policies, and love doing ADA training and doing disability bias awareness training. Well, 5 years ago, I decided to turn things around. I've stayed in disability my whole life. All my jobs have been in disability, but every now and then I take a different approach. Like I've worked in mental health. I've worked with people with intellectual disabilities and protecting their rights. I've worked with people with cross disabilities. I was the director of a Center for Independent Living in the 1980s and 90s, a long, long, long time ago. And that was a rural center. I live in Connecticut. So what passes for rural in Connecticut, it wouldn't even count as rural in Montana. We don't get that rural here. And directed mental health programs and done lots of different things. So I changed it up about 5 years ago and started getting involved in emergency management for people with disabilities during disasters. And that was the summer of 2017. And I remember studying it over the summer thinking, oh, there's so much to learn here. There's so much to know. Can I do this? And then hurricane, and I was a volunteer with the partnership, and I was a full-time consultant as well, doing other things in disability rights. And then Hurricane Harvey hit on August 25th of 2017, which is my foster daughter's wedding. So I remember everything together. And then Hurricane Irma hit on the Florida coast. And then Hurricane Maria hit in Puerto Rico. And we stood up a hotline. Marcy Roth was then the director of the partnership. And we stood up a hotline and started taking calls. And it was kind of learning by doing, because I thought, oh, I have to learn all these terms. I have to know how these things work. And suddenly I was called upon to staff a hotline. And before I knew it, I was helping manage the hotline. And before I knew that, I was working part-time with the partnership and just part-time as a consultant. And before I knew that, I was director of operations. And I just love the partnership. I love doing inclusive disaster emergency management because it's so critical. People with disabilities are 2 to 4 times more likely to be injured or die in a disaster.
Melissa,
yes.
I don't know if you are aware, but this is such a timely program. Montana has just been through a major disaster in terms of flooding, and many communities isolated, bridges that have gone out, people have lost their home. And I think that that really brings to mind people with disabilities. I mean, we don't have tornadoes here, but it is a disaster. And I don't know that we often think about the difficulties with surviving for people with disabilities.
This is Melissa, and I am aware the partnership hosts a call each and every day, 7 days a week, including holidays, birthdays, Father's Day coming up, Mother's Day coming up, Thanksgiving, New Year's, Christmas, Hanukkah, all kinds of holidays, Ramadan. We host it 365 days a year. And it started at the onset of the COVID-19 pandemic, but we also talk about other disasters that have happened as well, because the pandemic is still going on. So we need to think about that in other disasters. So I know all about what's happening because we have someone who calls us regularly, a woman from Wyoming who calls us regularly. And we also have someone from Montana. She's from Missoula, Montana, who calls us regularly. And Carlos drops in sometimes. And we have a hotline call, and I can put that in the chat or provide for you later for our hotline number. And people can call us 24/7. We're not live. We're not instant. It goes to a voicemail, but respond as quickly as we can to any kinds of disasters for people. So disasters, the climate's changing in the world. And we're seeing disasters in places we haven't seen them before. So I know I was talking to someone in California, and they used to have a fire season. Now they just have fires. And I know in Yellowstone, I'd heard there was the flooding. There was also some snow, and there were also some fires. So I'm really aware of that, and people with disabilities. And we need to remember that we have the right to equally effective communication and notice. They need to not just knock on your door. If you're deaf, they need to have strobe lights or a way of waking you up or getting your attention. If you go to a disaster recovery center or a shelter, you need to have sign language interpreters or video relay interpreting. If you're blind, you need to have materials in alternative format that are screen reader compliant. If you have a physical disability, you need to have accessible shelters. And if you have a mental health disability, mental health condition, then they might need to make some modifications for you because of that. Those are requirements under the Americans with Disabilities Act during disasters. And if you have a service dog, this happens a lot, your service dog absolutely positively gets to go into shelters. Your service animal gets to go into shelters. And I think that's really important for us to all think about and to remember that we have rights. And people sometimes say, oh, you have civil rights, but this is a disaster. What I want to say to everyone, the most important thing I'll probably say is civil rights are never suspended during disasters. They're never suspended, including during disasters. So you have all of your rights that you do under the ADA, especially during disasters when we need it the most.
Melissa, you had such a wonderful journey, and you are a witness to the changes that the nation has experienced since the enactment of the Americans with Disabilities Act, and you are a living proof that people with disabilities can succeed and live life to the fullest. Would you like to share with our audience what barriers you had to remove by yourself, and how removing those barriers in your career and your life prepared you for the position that you have now at the partnership?
This is Melissa. That's a great and thoughtful question, Carlos. Thank you for that. Well, I alluded to the first barrier my mother had to remove. My mother was a single mother. I was born in 1960s. So she was a single mother in the 60s and 70s. That wasn't a common thing then. And we're in suburban Boston. And the first barrier she had to remove for me was my ability to get an education. Because they said she had to fight. They didn't just send me to school in the next town. She had to threaten to sue. She had to call the press. She had to do all of those things. And while working full time, and she always worked very many hours, and she worked really hard. So she had to do that. So she kind of taught me how to do that. Then I got to college, and I noticed there are barriers there at college. And I was walking then most of the time. I used a wheelchair sometime, but not most of the time. And I kept thinking, what would happen if I used a wheelchair all the time? So the barrier I had to remove is attitudinal in my college, and I started a disability rights group. And we did things like put signs on the campus. This sounds silly now, all these years later, but it was the 80s, put signs on the campus in a restroom that was upstairs, in a dorm room saying, if you used a wheelchair, you couldn't read the sign because you can't get into this building. Or if you were deaf, you couldn't hear this conversation. I studied American Sign Language linguistics. I'm not a really good signer because my manual dexterity isn't great, and I've been told I sign like I have a moderate speech disability, but I try. But I got involved in deaf culture a lot then, and I got involved in all kinds of other disabilities. So I had to remove the barrier to go to college. Then I went to law school. First year law school was okay in that they had a kind of usable campus. It would be terrible by our standards, but I could kind of use it. Then the next year they moved to an inaccessible campus. So I then had to go to the press myself without my mother as an adult now. I had to go to the press myself and get rejected. And the press wouldn't cover the story that the new law school was inaccessible. So I couldn't use the law school for an entire semester, the library, the law school for an entire semester. So I had to work on removing that barrier. Then as I worked in disability agencies, sometimes because I didn't look like I had a disability, I had to remove the barriers saying, yes, I need accessible parking, even though you can't see my disability. So those are the kinds of structural barriers and attitude. Being a woman was hard. Women were really underrepresented. And also I remember going to national disability conferences where there'd be a couple people with disabilities in national disability organizations, and those events would be inaccessible. Some of that was pre the Americans with Disabilities Act, but I remember one event, the attorneys coming in said, oh, we're violating Section 504 of the Rehab Act. And they kind of went by me. So those kinds of barriers that were pre-ADA and even post-ADA. So having lived it every day, having chosen to deal with it every day, having to think about what made people uncomfortable with my disability every day, kind of got me to the point where I get to experiment. I did a program in a high school where I did bias training for a year for them. I also taught them how to do architectural access surveys in an urban high school that was 100% African-American kids, and got to do those things. So the barriers kind of helped me think creatively about things and also helped me understand how important my rights are and why they're important. And the ADA hasn't fulfilled the expectations I had in the beginning, but things have changed a lot in 32 years. Things are still bad. We still have people illegally in institutions, including nursing homes. We still have people that die disproportionately during disasters. A hugely disproportionate number of people with COVID die that have disabilities. I want to say it's like 100,000 people or 200,000 people. I don't have the number right off the top of my head right now. So sorry about that. But a hugely disproportionate number of people died. So we still have a very long way to go, and we still failed in a lot of ways. But I can go so many more places than I could before. And I see so many more events that have a sign language interpreter than I did before. So on one hand, I'm disappointed that we haven't come further. On the other hand, I see how far we've come. So if it's a good day, I tell myself it's a young movement. We're still learning. We're still new. A generation ago, most people with disabilities didn't work. We're starting to get in the workforce, though our unemployment rate is still around 66%. So we haven't made much progress in that. And that, if you said to me 30 years ago, would have shocked me, that we'd have all these civil rights laws and we'd still be unemployed in this way. So those are some of the things that motivate me. Does that answer your question, Carlos? I could talk for a day.
No, you did answer the question, and wonderfully. And I agree with you that the barriers that we face on a daily basis, independently of what type of disability we have, help us think outside of the box, think creatively and innovatively. And it kind of strengthens us to keep fighting and taking a day at a time. What would you tell the young people watching our show today? How would you encourage them to pursue a career like you did, becoming a successful attorney or finding a job, attending a school? How do we encourage them to pursue life to the fullest?
Well, my secret is I'm stubborn. A fancy word for that is tenacious, but it really means that I'm stubborn. If I decide I'm going to do something, I want to do it. And I don't want to suggest that every young person out there should A, become an attorney, or B, should be involved in disability rights, though you can, and there's room for you and we need you. But you can do, I don't want to say you can do anything you want to do, because no one can do everything. I can't be a neurosurgeon. I can't be a brain surgeon because I don't have the dexterity. Also, I'm not so great at math and I pass out at the sight of blood. So when people say you can do anything you want, that's not true. You just have to be able to do one or two things well. But when you put your mind to it and you decide what you want to do and what your purpose is, then you can go and do it. I'm fortunate. I always kind of knew what my purpose was. Since I was in high school, I knew that's what I was, in my opinion, what I was here to do. I knew what my purpose is. You can find your purpose. You can experiment. Don't let anyone close any doors on you because you have a disability. Don't let anyone tell you you can't. People told me all kinds of things. I was a straight A student, but they didn't want me to graduate from high school because that was hard. And I remember them saying to me, I have anxiety. Well, you have anxiety. Maybe you should go to community college, which is a great option for people, except I wanted to go to law school. And I said, that's a great option for people, but that's not the option I want. And maybe community college is a great option for you. So that's a great thing to do. Find your passion, pursue it, stick to it, and make it alive. And you just have to get up and do it the next day and the next day and the next day. Somebody asked me recently about, well, don't you burn out? It's like, yeah, sometimes I don't feel like I want to do it, but it's what I want to do and it's what makes me happy. I have no desire to retire ever. I want to keep doing it as long as I can, because I talked to some people recently who were enthusiastic about retiring. They worked in corporations. And I'm like, I don't want to retire. Why do you not want to retire? Why do you want to retire? And they're like, well, then we can do what we want to do. And I said, oh, I do that every day. I might not like each task I have to do every day. And sometimes we all have to put up with doing tasks we don't like to do and tasks that scare us. But each day I do what I want to do, which is, why would you want to retire from that?
Melissa, it's interesting. I started working with Lyft right at the beginning of COVID. And I think part of the reason Carlos was anxious to engage somebody to help with communications and public relations is people with disability and COVID restrictions became just really difficult. And can you talk a little bit about how COVID affected people with disabilities disproportionate to the regular public? We
died a lot more from COVID. We've had a phenomenally higher death rate than other people from COVID. I think our mental health was put at risk because we got isolated. I think we got far more isolated than other people. I think there are people who are immune compromised, who can't get vaccinated, who now don't feel comfortable in going out at all because other people have chosen not to get vaccinated. So that affected lots of our disabled brothers and sisters, our disabled siblings, that we can't go outside. And I think we felt cast aside. Lots of us got put into nursing homes. and during COVID, because what happens is when there's a disaster, it's easier to put people with disabilities in nursing homes. And those of us that went to nursing homes died at hugely disproportionate rates. So we died, we got depressed. We also get long COVID. And one of my fears, I haven't had COVID, I'm fully vaccinated, and I still stay pretty isolated, and I wear an N95 mask when I go out, and I do all those precautions. My fear isn't COVID right now, because the variant right now, to me, they know how to treat people, isn't as scary as it was before. My fear is long COVID, because I've struggled with fatigue. At one point in my life, I couldn't sit up for more than 5 minutes, and they didn't know why, and they had to figure that out. And that's not a cerebral palsy thing. That's an autoimmune thing. And I fear that, and I think that people with disabilities, particularly that are immune compromised and with autoimmune disabilities, or just other disabilities, are probably going to be a lot more susceptible to long COVID. And we don't know much about the results of that yet, except that it's significant and lasts a very long time. So it can make worse disability symptoms for some people, is my concern. And I think that's the big thing, because people see COVID, it's kind of like a flu now. And they don't realize that even if you have asymptomatic COVID, you can still get long COVID.
Which brings us up to the survey.
Yes.
And it's a program, we had a program last week that just introduced the survey alive. Can you talk about that? It's a national program, if I'm correct.
It is a national program that's a national grant, and Project Alive is working with 3 states, and Montana is one of them. It's Montana, Arkansas, and Missouri. And it's really exciting. What we're looking at is we want to remove barriers from people with disabilities who want to get vaccines. We're not pushing vaccines on anyone who doesn't want them. If you don't want a vaccine, that's fine. That's your business. But what we want to do is make vaccines available. So if you need access, you need it to be physically accessible. You need to be able to get into the vaccination center. Fine. If you need sign language interpreters, if you need material in accessible format to you, and if you need other kinds of things. So we're asking people questions about, have they gotten the vaccine, why they might not have gotten the vaccine, and if barriers got in their way to getting the vaccine. So I would like to encourage everyone out there to take the survey and let us know and give us information, what's getting in the way of your getting the vaccine, or just let us know if you don't want the vaccine. That's fine. That gives us some more data and some more information. So please take the survey.
Carlos, can you speak about what LIFT is doing in terms of the survey?
LIFT is working with a partnership in the state of Montana and promoting also access to the vaccine, COVID-19 vaccine, among the population with disabilities. The survey was the first step for us to have an idea of what barriers and obstacles people with disabilities in Montana and in our service area were facing and were preventing them from being vaccinated. We sent 410 survey in the mail. So far, we received approximately 50 responded surveys, and we identified a few barriers like lack of information, lack of printed information. There are no sites open 24/7 available for them to just go and receive the vaccine, lack of transportation for them to get to the place and be vaccinated, or inexistence of a mobile vaccine program. Departments of public health in the counties that we serve do not have a traveling nurse or a technician available to go to the house of the people with disabilities and give them the vaccine at home. And we are reporting those results to the partnership. and working with the Department of Public Health, finding ways to remove those barriers. We hope we will be successful in doing that.
Melissa, do you have statistics on the number of people with disabilities that have been vaccinated?
I don't have them off the top of my head. That's something that I could get back to you on. We just, Centers for Disease Control just did a paper where they talked about people with people getting Medicaid and Medicare and how often they were vaccinated and by disability groups. And I haven't had a chance to look at it yet. And the more people that can get vaccinated, the better, because they're going to protect themselves and protect other people, because it's still out there. And I just want to, go ahead, Carlos.
I was going to say that it's been a joy to work with the partnership. I think this short term that LIFT and the partnership are working together, we have already achieved good things and removed a few barriers out there. And LIFT would love to continue to work with the partnership. I also would like to speak directly to our audience. If you live in any of the areas affected by the flooding and the disaster that happened this week, please remember that LIFT is here to provide you with the assistance that you need. We now have an emergency fund, and we are prepared to help you fix your house or find you a temporary place to live. We are able to help you replace the devices and tools that help you live independently. If you need a replacement for those objects and instruments, please do not hesitate to call LIFT. If you lost documents and papers in this disaster, LIFT's independent living specialists are here to help you replace those documents and put your life back in order. Please do not hesitate to call. Visit our website at www.lift.org. And my name is Carlos. Thank you.
Thank you. I want to thank Melissa Marshall for joining us today. She's the Director of Operations for the Partnership for Inclusive Disaster Strategies. And we've had a delightful talk. Carlos, I think you did pretty good for your first time on TV.
I did pretty good because of my deafness, right? We didn't tell the audience that I am deaf, and I rely on reading lips and using captions, and I have television phobia, but it was fun. Thanks to Melissa and Corby for a fun time.
Thank you. This has been Living Well in Montana, a program of LIFT, living independently for today and tomorrow. And thank you for watching.